Allow me to introduce our guests who are already in the studio this morning. We have with us Honorable Cecily Barere, who is a Member of Parliament from Runyenjes. Also, we do have with us Honorable Dr. Joyce Laboso. She is the Deputy Speaker of the National Assembly and also Member of Parliament, Sotek constituency. Also, we have with us Esa Pasaris. She is the founder and the CEO of Adopt a Light. We have also with us Bishop Margaret Wanjiro, who is the Bishop of Jesus is Alive Ministries. Good morning, ladies.
Good morning.
Thank you for joining us. Right, I want you just to weigh in, especially in regard to where we are at, as the country also is facing up, the general election some few months from now. And now we hear from the CEO that, yes, even if it's intervening right now and introducing a bill in Parliament to try and, save the situation and push the date of a general election. Is this a problem that we've fomented for ourselves?
The timelines that we have for the IEBC to be well prepared for the elections are quite tight.
If we cannot get our act together, and if we don't want to get our act together for whatever reason, but let's respect the Constitution and let the new leaders coming in or the old leaders coming in respect the Constitution.
Will have tremendous effects, not just on the country socially, but also economically. And so, in my view, I think the government needs to double its efforts. If it needs to hire twice the number of technical staff or resource from outside, they need to do everything they can. Now, are we ready for elections? Yes. Some of us were as ready as yesterday. So we are not going to allow any extension.
Previously, you've said that you've accused him of using dirty, outdated tactics by saying you are unqualified and also you're married to an outsider. Is that true? So the tribal tag here also is also being used to actually against you.
And Debal, I think that's why you hear us talk all the time about this, that women have some special challenges that would never, a man would never have.
Yes.
Like the question of somebody coming to dwell on an issue of where you are married. Which politician have you ever had, man politician, have you ever had being asked, who is your wife? And how is your wife supposed to be impacting on your ability to perform as a governor? So I think it's an all outdated, really has completely, absolutely nothing to do with performance, with service delivery to the people of Bomet.
Right, contribution here on AM Live. That was on the Leadership Forum every Friday. Right, maybe in closing we can just, of course, hear from our panelists just briefly, 1 minute, Otene Amollo in closing.
Well, two quick
for the
things.
people of Bomet and the family. Yes.
First of all, we've all paid our tribute to our fallen colleagues. But I think the point that the late governor brings out is important. The question of extraction and women in politics. When you're asked, what is your extraction? And where do you come from? Is it where you are married? Is it where you are born? Is it where you are working? And it's an unfair question. But as I close that, I think it is now time to think about establishing an institution along the line of the Food and Drug Administration in the US. An institution that can focus wholly on these whole things in terms of food production, food distribution, the drugs that we administer and how we administer them. Because I think the institutions we have are rather sectoral. They don't cover the whole spectrum. I think that might be something to consider.
Right. Bode Holole, briefly.
I think I just want to speak to the issue of funding of research into cancer and other ailments.
Yes.
In the US, when you are running for president, one of the questions that you're supposed to speak to is, what is your policy towards research and technology? In Kenya, it does not exist, to the extent that even the little research that our professors are doing here in our universities is funded by private people outside Kenya or other companies that are the ones who support. Like the best that we have in Kenya today is something called the Kavi Clinical Research Institute at Kenyatta Hospital by the University of Nairobi. It receives funding from outside. In fact, I know that last month we were opening a newly built branch at Kavi, at Kenyatta National Hospital, purely funded by the Americans. Why the government does not have time to fund in our local needs, I do not understand. The issue raised by Jakoyo, that you find a governor, for example, he has invested in a toilet in a public place in Siaya. It also happens in Kakamega. And you find that this toilet they have invested in money is a good thing. A public toilet is a good thing. But they ask the villagers to pay 10, 20 shillings before they use the toilet. So you find the toilet is not being used. The mama who is doing mama mboga or at the market would rather reserve her 20 bob to buy food for her children rather than go and pay for the eco toilet.
Yes.
So priorities are being looked at upside down, and these are issues we are supposed to grapple with.
All right.
Yeah.
Let's hear from Aaron Chirot, briefly.
You know, just as a parting shot, Ibal, one of the things that people may not have known so much about Joyce is that she was extremely witty with her replies to some of the challenges that she faced, and particularly on this one of her marriage being used by her opponents to try and pull her down. The story of how she finally dealt with this Dibal is that one time she waited at a full public function with thousands of people in Bomet, and her opponents had been harping long and loud about, oh, she's a foreigner, not married here, we shouldn't consider her for leadership. Of course, her male competitors. And when it was her turn to take to the mic, and there was a gentleman who was a PC, former governor Isaac Ruto, and another gentleman. Joyce wittingly said, but wait a minute, I am a lady. A lady waits to be approached. You so-and-so, you so-and-so, and you so-and-so. We were together at the university at the same time. There is not a single day that you ever sought my hand in marriage. So if you kept quiet at that particular time, please forever remain silent.
Don't talk about it now.
And the whole crowd went wild. And that, you know, in agreement with her, and said, oh, if you didn't speak at that point, please never speak about it at this, because a woman will never marry herself. So, and that ceased being a topical issue from that particular time. It's just about how the unique, actually, like she was talking about, the unique challenges that women continue to face, and how as men sometimes, and I hope none of us on this panel, if you're to ever have a female competitor in any of our politics, will resort to some of these dirty old tricks. Just take on them for who they are as a fellow leader, but not
Right,
gender.
Thank you.
Well,
Thank you,
Dibal, I think God deservedly takes the best, except in this scenario we have been robbed of so many people in the last few months, regrettably. I can only say, may God rest their souls in peace.
Right. Finally, Kimani Otange.
Yes, Dibal.
And you've not discussed about the bill itself as well. I would really love to know what is the way forward.
Okay, my closing comment on that issue is really that we need to have a concerted effort on cancer control and if possible, even prevention. What I'm saying, Dibal, is that what we know now is that one of the best ways to deal with cancer is to have it screened and noticed early. Then you have a good chance of controlling it and even eventually maybe curing it. But if you look around at what happens, you realize that, for example, you see so many government-sponsored medical camps. Even members of parliament, you find that there's a medical camp on eyesight, there'll be a medical camp somewhere on weight control, others on diabetes, but you barely hear at any one time that there is a sponsored program, for example, by government for cancer screening, or even those kind of camps. And the sooner we move towards now sensitizing our people and let them know that now, because this is the reality we are dealing with, that cancer is now an increased risk that is very high, the best way to deal with it is get yourselves screened. The way we promoted VCT centers, and we established them all over the country, and we were telling people, go and get screened. And there were adverts sponsored by the Ministry of Health on our television. telling people the essence of going to be screened for HIV early enough so that you can be treated. So unless we also intentionally take an approach better than that one, so that our people are sensitized. And then lastly, Dibal, on that question of funding, we have institutions already existent, for example, like Cambridge. Increase funding to an institution like Cambridge and sponsor the researchers there, help them to develop our own ingenious ways of at least managing and dealing with cases, for example, that are detected early. And then you would say that we are starting to do something. Otherwise, the position we are in right now is just whereby we are all lamenting, including government. Everybody is watching helplessly as people go one by one to a disease that we are saying now is turning into an epidemic.
Yes.
And so let's agree, all in all, that enough has not been done. And that's why I said earlier, if we all sit and fold our hands and wait for the solution to come from the USA or from Britain or from Germany or Japan,
yes.
How many of our people will we have lost?
Thank you.
It's got to start with us.
Thank you. Right. Thank